everyone. We have two very special guests with us today. I wanted to say a little bit about why we decided to do a podcast. Number one, we really want to get the word out about the work that we're doing at the Frazier Family Coalition for Stroke Education and Prevention. But more importantly, we want to bring the community, we want to bring our experts at Jefferson and Temple together and throughout the Philadelphia area to really do some focused conversations about health, providing individuals with some evidence-based information. We want to make sure that we engage individuals in the work that we're doing because we want people to adopt a healthy lifestyle and really look at ways that they can integrate health into their everyday life that's not overwhelming. So today we have two very special guests. We have Mrs. Frazier, Mrs. Andrea Frazier, and we also have Dr. Robert Rosenwasser. So I'm going to start by telling you guys a little bit about Dr. Rosenwasser. Dr. Robert Rosenwasser is the Dr. Jewell Osterholm Professor and Chair of Neurological Surgery. He's also the President and CEO of the Vickie and Jack Farber Institute for Neuroscience. He is the Enterprise Senior Vice President of Jefferson Neuroscience. He's the Senior Vice President of Strategic Clinical Alliances and Professor of Neuroscience, as well as a Professor of Radiology. I was also doing some background on you, Dr. Rosenwasser. This is something I didn't know. This idea that you were dually trained and doing cerebral vascular surgery, neurosurgery, not only just with diseases of brain circulation, but also looking at conventional surgical methods using minimally invasive radiology. So I thought that was amazing. In addition to all of the things that you treat, strokes, aneurysms, and all of the work that you do. So we're going to start by talking to Mrs. Frazier. And Mrs. Andrea Frazier has been a long patient advocate. She is a community activist. She does work with a lot of volunteer agencies. She does work with the American Heart Association. And I mean, it would be such a long list. I don't think we would have time to go through all of the amazing things that she does. But Mrs. Frazier, I want you to tell our listeners a little bit about yourself and then what really inspired your vision for the Frazier Family Coalition for Stroke Education and Prevention.
Okay, well, thank you so much, Dr. White. It's a pleasure to be here today. We are so excited to have Dr. Rosenwasser join us for the conversation, and thank you for asking me to join the conversation. Um, we're so excited to bring to you Healthy Living Philly. So what inspired me for setting up this stroke center was I was having lunch with Dr. Rosenwasser one day, and we were talking about ways in which we would be able to help the community in Philadelphia, because what we found was that Philadelphia has the fourth highest rate of strokes in Pennsylvania and in the nation. And that was a very disturbing fact. And I thought, well, perhaps there might be something we can do together to help to alleviate some of this suffering and to help people have healthier lives. And Dr. Rosenwasser had a wonderful idea of maybe we could start a stroke center. Maybe we could do something to help prevent strokes in the first place so that we don't have to worry about treating them or treating as many of them. And we thought that was a great idea. And we talked about it a little more, and lo and behold, it came to fruition. It became a reality. So I'm just thrilled that we had that conversation and that we were able to bring a vision from a conversation that we had about this many years ago. We started the Frazier Family Coalition and for Stroke Prevention and Education back in 2020. And then, of course, the pandemic came and we ended up having our ribbon cutting in 2022. So we've been in operation for a while, but only open to the public since 2022. So we are thrilled to be in our spot in North Philadelphia where we can service the community. And it's just been a wonderful gift for me to be able to participate in something so unusual and interesting, and something that I truly believe will be helpful to the community. To tell you a little bit about my background, I met Dr. Rosenwasser 36 years ago when I delivered my daughter, and I had a stroke about a week and a half after that. So that's not the way that you want to meet someone, but as it turns out, I'm glad that it was Dr. Rosenwasser that was there. So I've known him for many, many years. And after I was discharged from the hospital and got well and was on my journey to wellness and healing, um, I hadn't seen him for a while. And we were doing a program in subsequent years for the American Heart Association. And we were able to reconnect again at that point. So I'm thrilled to have had that opportunity to reconnect with Dr. Rosenwasser and his wife, who incidentally was my anesthesiologist as I was delivering this baby. So we kind of came a full circle, and have been involved with both Dr. Rosenwasser and Dr. August. So I'm thrilled to have that opportunity. As I said, I had a stroke many years ago, 36 years ago to be exact. And my health journey has been a very long one, but it's been a very fruitful one. And I've been able to adapt a healthy lifestyle. And I hope to share some of that with some of our participants through the podcast and at our stroke center. One thing that I found is that it is very difficult to start. You kind of think of things that you want to do, but you actually have to make a conscious decision that you're going to start today, and you're going to start small. You can't go from being a couch potato sitting on the couch 5 days a week to going to the gym all of a sudden 5 days a week, because that's not sustainable. So we try to get into that gradually and effectively, and you'll see small results as you go along, and that's encouraging to you, so you continue to work at things. So it's been a very long journey, and I've tried to adopt many things to help my lifestyle become more healthy, such as healthy eating, exercising, um, and just doing a lot of mental exercises as well, so that part doesn't get stale. So it's been a lot of work, and we can get into some of the specifics about that later on. But I just wanted to share a little bit about my background with you. So thank you.
So thank you. Dr. Rosenwasser, I know that when we talked and when we got your introduction, there's a lot of things there's a lot of stuff that you're responsible for around here. We just wanted you to maybe talk a little bit about your work here and anything you'd like our listeners to know about you.
Well, I'm not from the Philadelphia area. I'm from New Orleans, Louisiana. Came up here and trained and met my wife in this area, and and the rest is history, I guess, except for a short time when I was at NYU. Um, at Jefferson, yes, I'm the chair of neurological surgery and head of our neurological institute. But my love has always been cerebral vascular disease, neurovascular disease. So my whole career has really been devoted to the management of stroke conditions, whether they're due to the blockage of an artery or bleeding. And being I guess, an adopted Philadelphian, right? An ounce of prevention better than a pound of cure. And that's really, Ben Franklin was a smart guy. And so when Mrs. Frazier and I first met and spoke, we talked about uh, the health disparities, which is really important to all of us, and how can we bring better stroke care, stroke prevention to an underserved community. Mrs. Frazier also indicated early how the stroke rate in Philadelphia is higher than most cities in the United States, and in some particular zip codes where the Frazier Center is located, it's 7 times higher than the rest of our metropolitan area. So I think that it was an ideal site to really work with a population and a community that is underserved, that needs the education, because it all starts with education. If you think back on it, 35 years ago, people didn't know the symptoms of a heart attack,
That's right.
right? Now everybody knows it's chest pain and arm pain, and women can have neck pain, right? And it was education of the public. It was really education of the public, which is so critical. And so, stroke, again, there are common denominators in terms of risk, right? The same risks for stroke are there for heart disease, obesity, hypertension, diabetes, right? Smoking, all these things, they're all common denominators. Poor dental hygiene has been shown to be a significant risk factor for cardiovascular disease, stroke, and heart disease. So, Mrs. Frazier and I, we talked and we thought about it and how we were going to do this. And thank you, Dr. White. We got you involved. You're the brainchild about the executing of all this. So, you're humble. You need to spend some time telling us about yourself. But you've really executed on the ideas that I think Mrs. Frazier and I had, and you grew them. And it's about taking care of a population and educating them to help themselves, right? Diet is important. Everything's important. So, a couple people have asked me, and I think Mrs. Frazier may have asked me this a long time ago. She said, well, how will we know if we're successful in the Frazier Center? And I said, I'll be out of a job, because that's what I did. So, that's a little hyperbole, but, obviously, if we're doing the right thing, fewer people will have strokes, fewer people will lose their limbs to diabetes and hypertension. There will be fewer strokes. That's how we will know whether successful. And, I'm not going to share your thunder if you're going to share it, but a lot of the metrics that we have been following are starting to demonstrate that, in fact, we're really are making an impact in reduction of stroke and heart attack and limb loss in a very, very vulnerable population. So, kind of in a nutshell, that's kind of what we all do.
Yes. Well, I feel extraordinarily blessed to be able to be the executive director of the Frazier Family Coalition. I've been at Jefferson for 25 years. And I think everything I've done at Jefferson in the area of community health has prepared me for this time. And I know it was a long journey, Mrs. Frazier, having the concept, having the vision, and going through your personal health story, but it's landed us here. And I would say the same thing with Dr. Rosenwasser. I don't think it's a coincidence that the three of us are here and are working together. I feel like this was almost ordained in my mind, because I'll tell you something. I look forward to going to Frazier. I look forward to sitting down with our team and kind of saying, what are we doing next? What ideas do folks have? And I think the community enjoys coming to the site. We really offer chronic disease self-management education in the area of hypertension management, diabetes management, pre-diabetes management. We have a pretty solid nutrition therapy program that we do, with both offering people healthy plant-forward meals, as well as looking at how we prepare those meals, how we shop on a budget. We're also doing a program right now with Temple University on making connections and helping older people feel more connected to them, not only just to their immediate neighbors and family, but how they reach out, so that we can kind of limit some of this loneliness that a lot of people are experiencing. We just had a men's health breakfast a few weeks ago, and we had about 90 men show up on a Saturday morning, which I think is extraordinary, but it's a testament to the work that we do. Any given Saturday, you'll find us in a North Philadelphia barbershop doing circulation screening, connecting with the men in the barbershop. So I think the sky's the limit at Frazier in terms of our creativity and how we want to get the word out in the innovative way that we want to reach people. And I think today that's what you really need. How can you reach people in a way that's not, that's different? All of our programs, with the exception of Lunch and Learn, are offered hybrid. So people can use, a virtual experience as well as an in-person experience. I'll give you an example. Yesterday, we have a Sugar Smart Circle, which is a support group for diabetes that we do with Temple. We had just as many people in person as we had on Zoom for the hybrid experience. So it's nice to have folks on both sides, and it really kind of eliminates some of those barriers that people have to transportation, childcare, and all the other things that people may have to deal with. And in all of our hybrid offerings, you can remain anonymous. And sometimes people do want to be anonymous. So I want to ask you both, when you think about the Frazier Family Coalition, how important do you think it is to the community? Is there something that we could add to make it a little bit more important or more interesting to the community? Just why do you think something like this, the community has really responded so well?
Well, I think I'll take a stab at that. I think it's very important to the community. We are seeing that people have responded very well to the types of programming that we offer, as well as the opportunity to come in and have screenings done when we go out to various sites, like you mentioned, going out to the barbershops, we do screening there. It's one of those kinds of outreach programs that we offer that allows people that may not have access to a regular healthcare facility or healthcare in general to come out and find out some information about where they are in their own personal health journeys. And I think it's really important to offer that to the community. And I think the community has responded really well by taking advantage of the things that we offer. You know, we have the food giveaways where we are trying to combat food insecurity and help people to eat healthier. Um, and I think that people have responded very well to that. It's been incredible to be a part of two major health systems in Philadelphia and see them come together, to see Jefferson and Temple working together for the good of the community. In a lot of instances, they're competitors, but this is not something that we were competing on. We're both trying to do good in the community and trying to help people live healthier and more fulfilled lives. So I'm just really pleased that we've been able to bring those two health centers together to work toward helping the community. And I think the other thing is it's one of the few programs that exist where people can go and they can come into the center, or they can participate in offerings virtually and feel like they're a part of something that's really doing well in the community. So I thank you, Dr. White, for all of the programming that you've put together that's been absolutely phenomenal. And I certainly thank you, Dr. Rosenwasser, for being a big supporter of ours and putting us under the Jack and Vickie Farber Institute for Neurosciences, because this is definitely something that will help with people's neurological health as well as their overall health. So I'm very grateful to both of you.
Thank you. So I'm so glad you mentioned the team and the fact that we're working with Temple Health as well as Jefferson Health. I also want to shout out to the Nicoletti family. The Nicoletti family, Mark Nicoletti, who leads this effort with us, and just how he has not only served as our council advisor, but he also, along with his sisters, have really provided us with a space and really provided us with, I like to call the Liberty Square space our family, because we're located at 1300 West Lehigh Avenue. There is a dialysis center. There is a NET, which is a family care service program, and they have over 600 foster children that they service. We also have federally qualified health center next door, Fairhill Community Physicians. And so we've all come together, and a major parole office. We've all come together as a family as well. But none of this could be done without our team at Frazier. We've got a staff that I would say, bar none. Our staff, Chef Janetta Frazier, Cheryl White, Giannis Sidnor, Sophia Friedeborn, Georgiana Drain, and then on our Temple side, all of Dr. O'Connor and April Bidell and all those people at Temple that really helped to bring all of this together and work tirelessly to make it all a success. So the last thing that I want to leave the listeners with is I want you all to give us some words of wisdom as it relates to what we can do. Those of us who, we've had enough and we can't stand it anymore. We want to get on this health journey. We want to get on the road to better health. Some of us are on the road, but we keep looking at that Haagen-Dazs and all that other stuff, and sometimes slipping a little bit. That's my I said that's my kryptonite. Haagen-Dazs ice cream is definitely my kryptonite. So we got to. I want you to leave some inspiration and some tips on how to keep that brain healthy, Dr. Rosenwasser, and just how to get on this road and stay on this road.
Well, I'll happy to go, and then we'll have some words from Mrs. Frazier. I just want to go back to how much has been accomplished, because this was an uncharted journey, right? It was an uncharted journey to work with another university. It was an uncharted journey about developing trust. Nobody likes going to doctors. Nobody likes going to doctors, right? Except maybe for prenatal care. That's a happy thing. But other than that, most people don't want to go to doctors, and men are the worst. Men are the worst. And so, so I think it was, you and your staff, and I know Mrs. Frazier frequents the site very often. I think developing the trust with the community was paramount to its success, because they said, oh gosh, this is another just doctor's office or something like that, right? But I think the community has really looked at this now. Hey, this is a resource. They're trying to keep us out of the doctor's office, and they're trying to keep us out of the hospital. And I think developing, one of the things that I feel so good about is how you've developed the trust of the community. They view it as a resource to learn and how to take care of themselves, because no one ever bothered. I mean, no one ever bothered to talk to them about these kinds of critical issues. And like I said, men are terrible patients, and they don't want to hear this stuff anyway. But I think
I'm glad you said that.
I've been in this business a long time, and I do know that. And so I think that bringing this kind of educational program about their own health and well-being I think it's something that's new to everybody. It's not just that particular area. This is true for the communities in every socioeconomic environment. Most people don't pay attention to that. So I think, what you've created is an unbelievable model. I guess if I could give any kind of medical or professional advice, if you're not sure you're having something going on, ask somebody, and it may be nothing, right? But if you don't know, don't say, I'm going to go to bed and sleep it off. I'll be fine in the morning. Well, don't know that. I think the Frazier Center is a place where you can say, hey, I had this thing going on, and what do you think about it? Right? Is this something I should worry about or not? And I think you and your staff have developed a trust where I know you're getting asked that multiple times every day, right? I think I would like to see it. We got to give you a vacation or get you some help. I would like to see the Frazier Center be there 7 days a week. 7 days a week, because I think you'd even be busier, because people work, right? It's hard to do that. And I would like to see it be a 7-day-a-week operation, not a 5-day-a-week operation. And that, because healthcare doesn't stop on Friday at 6 p.m. and pick up again at Monday at 7 a.m., right? But I think that I think it's a great resource. I think it's helping not only education about all kinds of health issues. I think you, above and beyond that, you've raised a self-awareness in the community that probably maybe was there. I don't know. I think in many communities that self-awareness is not there. So I think it's what I like to see is it's been a huge resource for underserved populations. But I think that you can take this to populations that are not underserved, that don't take care of them. So I think it's been a great thing, and I think it's a wonderful resource. And I think we just need to continue to grow it and make it bigger and make it 7 days a week. And don't ignore the symptoms. If you're having symptoms, right, ask somebody. It may be nothing, right? But if you don't ask, you're not going to know. So That's
And
all I
Mrs.
have for
Frazier? Well, that's a
Well,
lot. That's a
yes.
lot.
Well, I agree with everything that Dr. Rosenwasser just said. I think that the center is going to, moving forward, I think it's going to be a integral part of the community and a place where people can come and have their questions answered if they are feeling something or not feeling well or wanted to talk to somebody about something without having an official doctor's appointment. They can stop in and talk to someone in the center and get some information about what's going on and perhaps get some encouragement to go see about whatever the issue is. I think it's also really important that people feel seen and feel heard and feel like they have a place where they can come to bring their, not only their health issues, but sometimes people will come in and ask about, they're having trouble with something in the legal system. And we're not a legal center, but what we've found is that I've been so blessed to have so many people offer to help us from various walks of life. So we've had lawyers offer to help us, we've had financial people offer to help us, and it's wonderful to be able to present these programs to people about family law, for example, or how to use your computer so that you can get on a telemedicine call, or so that you can access your health records. These are all things that could, if once you don't have them, they contribute to your stress, which ultimately contributes to these chronic diseases like hypertension. So it's really important to address those kinds of issues as well. And I feel like, Dr. White, you've done an excellent job of bringing all of those kinds of things together for the community in the Frazier Family Health Center. So I think that's been an incredible resource for the community. And I think, just answer the question initially, I think the first thing that you have to do is to start your health journey is feel that what you're about to embark on is going to make a difference. Sometimes you do things and you kind of say, well, what difference is it going to make? It's not really going to matter. But if you approach it from the sense of, well, I think if I do these things will ultimately help me, and they may not I may not be able to run a marathon, but I think these things will help me to live a healthier lifestyle and be a more productive member of society. So I just think that it's critical that we continue to offer these programs. And like Dr. Rosenwasser said, it would be wonderful to expand that to 7 days a week because health problems don't end at Friday evening and pick up again Monday morning. So I totally agree with that. But I am so grateful for all of the help and the resources that you and your team have provided to the community. So
Well,
I
thank
say,
you.
go
Thank you.
ahead and get on that health journey and make a start today.
Well, thank you again, Mrs. Frazier, Mrs. Andrea Frazier, and we have to mention Mr. Kenneth Frazier, who was born and raised in this community and really wanted us to be in this community and give back to the community. So we definitely got to give a shout out to Mr. Kenneth Frazier. So on that note, I thank our guest, and we're going to reserve the right to bring you guys back at a later time and hear more about what you have to say about the health of this community, embarking on a health journey, and all the things we need to do to stay where we need to stay. I want to just tell our listening audience that our podcasts are hosted on our Healthy Living Philly YouTube channel. We also have a Frazier Family Coalition YouTube channel, and we have our social media platforms, which are Instagram, Frazier Family Coalition, and Facebook, Frazier Family Coalition. And on our Frazier Family Coalition YouTube channel, we have several educational videos. So if you want to learn more about stroke, you want to learn more about stroke and diabetes, you want to learn about nutrition, I would like for you to go there. And please go to our website, FrazierFamilyCoalition.org, to see all of the programming that we offer, both in person and virtual. Again, I'd like to thank our guests, Mrs. Andrea Frazier and Dr. Robert Rosenwasser, because without them, we would not be able to do this work. So thank you all so very much.
Thank you.
Oh, thank you very much.